It's not only an honor but a privilege to introduce our speaker tonight, Dr. Katy Woods. Dr. Katy Woods is an assistant professor of counseling here at Chadron State College. She received her PhD from Texas Tech University. She also holds a master's degree in counseling and school education. She's a national certified counselor, and her credentials go on and on and on. So she certainly has experience in the field. And not surprisingly, she brought her partner, well, I guess both partners, her little dog, Pearl. She's currently training Pearl to be licensed in animal assisted therapy.
We're in the process, so when she misbehaves, know that she's not yet licensed.
Anyway, the title of her talk is Animals, Mental Health, and Wellbeing. So if you would all join me in a hearty welcome for Dr. Katy Woods.
Thanks, you guys. It's really great to be here. This is my first Graves lecture. It's actually my first presentation on campus since I started. This is my third year as a professor, so I'm still learning the ropes. But it's exciting, so I'm glad to be here. I'm glad you all could come as well. What I'm going to discuss about, or what we're going to talk about today, is animal-assisted therapy. It's a pretty growing field. Every year, people become aware of it. People start to become more involved and want to incorporate animals into their therapy or incorporate animals into their volunteer work. It's becoming much more popular across the world, essentially. And that's because there's so many wonderful benefits to having a dog. How many of you guys have pets? Yeah, see? That's why you're here, right? I couldn't personally live without my little girl, so I know how much pleasure she brings me. And if anyone wants to sit down and talk about their dog with me, I can't help but talk about my dog. And I can't help but become comfortable and feel bonded. And that's what this is all about. It's about having an animal with you when someone's in crisis, or when someone is upset or sad or depressed, or even the more serious illnesses such as schizophrenia and some psychoses can benefit from having an animal in the therapy session with them. So let's go down with I just learned how to use a Prezi, so I'm very excited. But that also means I'm not sure what I'm doing. Okay. This is just a great quote that I found that I thought was very appropriate. Here comes Dr. Everetson, late as usual. Pearl says hi. Okay, well, see? Prezis just move around. It's really cool. All right, so this is just a nice quote that I thought was So this, as you can see, is my little girl Pearl, and this is Pearl's dad. His name is Boudin, and he is a working animal therapist, co-therapist with a friend of mine back in Texas. Look here. You want to sit for it? Good girl. A friend of mine back in Texas, and she takes him to school. She's currently a school counselor, but she's also taken him to her practice when she and I worked together at a pediatric clinic doing counseling with the children, and she was able to bring Boudin with her to work, and it's just magnificent to see him work. I wish that Pearl had watched a little more closely, but he's the most amazing dog ever. So this is Pearl's dad. I wonder if I can just do that. I can. Awesome. So a little bit of history about animal-assisted therapy. Believe it or not, way back in the ancient Greeks used to use hippotherapy. Hippotherapy is when therapists bring clients and bring children, bring whomever with horses. And you can learn, specifically hippotherapy is when people with disabilities can get the feeling. They ride the horses, they're close to the horses, and it gives them a sense of rhythm, and it helps with their disability. And it's been shown to be very useful. And apparently the ancient Greeks used to use it as well. The first recorded use of animals in therapy was with the Society of Friends back in 1792 in England. And they used animals, and they claimed that it would reduce the use of harsh drugs and restraints. By integrating animals into their therapy, they were able to make great strides and lighten up on the drugs, which is always a good thing. In North America, the earliest recorded was back in 1919 in Washington, D.C. And this is where dogs were introduced as companions for residents at a psychiatric care unit. Since the 60s, so then it grew and it became more popular, and there was a little bit of time in there where it was kind of forgotten, but then around the 60s it started really picking up again. And here, after that, there were just a number of professional therapists who started integrating animals into their therapy. This statement says that there's value in animals as a therapeutic tool, and that's a common language that's used in animal therapy. I don't really like it. I consider Pearl my co-therapist. She works with me. She's not a tool, in my opinion. And because she's my co-therapist, then she and I work together to help people. And this is just a little helping out. What was his name? Timmy. She was helping Timmy.
Yeah. Must have fallen down well.
Not yet. He was sleeping. So that brings us to modern day and what's called animal-assisted therapy. The Delta Society is a society that helps license and sets up guidelines for animal therapists. They are now called, they were called the Delta Society. Now they're calling themselves Pet Partners, which is a nicer name, I think. So Pet Partners is what they say that an animal-assisted therapy is that it's goal-directed intervention. And through that intervention, you have specific criteria that's met so that you can then treat people and have to meet those goals. They stress that it should be administered appropriately, of course, by a trained healthcare professional. This is animal-assisted therapy. There's another wing of working with animals that doesn't require therapists. But for animal-assisted therapy, it requires a trained healthcare professional, and essentially it's just like any other healthcare or any other session. If you're working with a person, you want, whether you have a dog or not, you need to have goals, and you need to have interventions and strategies and a treatment plan. And same thing is expected when you're using your animal in therapy. Here we go. Delta Society is now Pet Partners. They're considered to be the leading North American organization, and they've been around since 1977, which is a long time. They're nonprofit, and they're a good company, a good organization. Here's where they differentiate between animal-assisted therapy, which is engaged in by healthcare professionals, as opposed to animal-assisted activities. Animal-assisted activities are what you normally see when you're in a hospital. Say, for instance, you're in a hospital and you see a volunteer with their animal, and the animal's got a little jacket on, and they're walking around seeing people. Typically, that is animal-assisted activity. That's not a therapist necessarily. It's a volunteer who's gone through lots of training, and the dog's gone through lots of training as well. But they aren't therapists, so they're not engaging in one-on-one therapy. And so that's where they kind of differentiate. Again, that's called animal-assisted activities as opposed to animal-assisted therapy. Oh, that was Pearl's puppy. Isn't she cute? She's fuzzy. She grew up a little. So what animals make good co-therapists? Pretty much, well, there's a whole long list of them. These are the most common ones. We got birds. Parrots are great, as long as they don't bite you. Horses. Rabbits. Rabbits are wonderful because they're so soft. Hamsters. Dolphins. I'll show you a little video here in a second that shows people swimming with dolphins, and it's a form of therapy. Fish. I have to give you a little story about Pearl. Definitely her therapy. She will sit in front of the fish tank and watch the fish for hours. We call it fish TV, Pearl TV. And I think it lowers her stress for a little while until they move, and then she wants to eat them.
It doesn't lower their stress.
It does not lower their stress. Cats are good. The one thing you do have to be cautious of is when you choose an animal to use, an animal that is less likely to promote allergies. You want to think about that. And a lot of people are allergic to cats. So if you're using your cat for therapy, you want to check with the people you're going to visit first to make certain that they're okay with that. And dogs, of course.
Big smile.
It is, isn't it? That's a great picture. So how do we train them? Very carefully. First, animals have to go through a temperament test to make sure that they have a calm, gentle temperament, and they're not gonna eat anyone. Next, they go through all the obedience training and learn how to. You want to make sure that you have control over your animal if you're going to have them in a public place. So, if Pearl has gone through the Canine Good Citizen, and she has her little graduation certificate for that, and that is the upper obedience training that you have prior to becoming licensed. Then there's another licensure exam that she has to go through, which we haven't done yet. She has to learn to walk by food without touching it. We haven't quite mastered that one. So once they do that, then they have the AA training, which is you train and then then you pass that final exam. So what kind of training is there? Here we go. Skills exercises. So they go through, it's kind of small up there, but they do these different exercises. They need to be able to be calm when a dozen hands are all over them. They need to learn how to sit quietly. They need to learn how to not eat somebody else's food. There are lots of little things, all these different exercises that they will go through, and they need to pass actually all of these when they're going through their training. There are also performance aptitude exercises, and this is just determining what their temperament is like, and if they're going to snap, or if they're going to get angry or upset if they hear a loud noise, for instance. So through the training, they also have to become accustomed to all the different kinds of movements. Like I said, excited movements. Pearl is not so great with children, I just have to say, because they move like crazy and they have these awkward stances, and she doesn't really like that. She doesn't understand them. So so she could not work with children. But there are lots of other animals out there that are perfectly comfortable with that. So you just have to determine what each dog prefers, or what each animal prefers. You also have to have them around lots of things that you would normally find if you were in a mental health facility, or if you were in a hospital or a nursing home. When I was working as a counselor prior to getting this job, I worked I did counseling in nursing home facilities, and I'd take her with me on occasion. And she likes to sit in the chair.
Come on up if you're going to do it. Here you go.
She can't see.
She can't read it.
So when I would take her to the facility, I had to make certain that she was okay with wheelchairs and she was okay with crutches, and that she could walk by a walker and not freak out and want to bite it, And she was great, actually. I was really impressed with how well she handled that. So let's see, who does it? Who does animal-assisted therapy? Lots and lots of people, actually. Because there's animal-assisted activities, you can, as long as you qualify and the dog passes all the requirements, then you can become an animal-assisted therapist. You don't have to have, or not a therapist, but an animal, you can become a pet partner. And you can volunteer and take your animal with you to anywhere you want, as long as and you will get a little certificate, and your dog will get a little license, not a license, but a little tag and a little jacket to show that they've passed all of those requirements, and that you can take your animal and spend time with them, and it can be really fulfilling. But then also you have the therapists, and you have the social workers, and you have psychiatrists and psychologists and clinical school counselors. Like I said, my friend Mari and Pearl took Pearl's dad with her to school counseling and with the kids, and they just, of course, she said she saw so many amazing, so much amazing progress with children that she didn't see without being there. So it's really useful. She's a huge fan, of course. Mental health counselors also. And this is just a little example of what some treatment goals would be and what you would do in animal-assisted therapy to meet those goals. So, for instance, let's say you wanted to decrease symptoms of anxiety or agitation. What could you do? Well, you could hold or take, see, I can't read that either, you guys.
Yeah.
Let's see if we can make that bigger. Ah, look at that. Those presents are great. Okay, you can hold or stroke the companion animal while interacting with the therapist. So if you are anxious, it helps to have something and someone, I already feel better, to hold her and pet her, and it helps to relieve the anxiety. You can have your client talk to the animal and receive affection, and it can help somebody to calm down and relieve their anxiety. How can you identify and reduce irrational thoughts, which trigger and exacerbate anxiety? Well, these are all about anxiety. You could, if a client is a child, then you can ask them to confront their fears and play a card game with their irrational thoughts. And all of it is with the animal right there beside them, and they're kind of working with the animal. Whoa, okay, well, we'll just skip that one. And this is me and Pearl. I just wanted to throw that in there. This is a little video about animal-assisted therapy. Okay, so where? Where do we use animal-assisted therapy? Well, in schools, hospitals. Oh, you have to look at that picture. I went too fast. That's a golden retriever lying in a bed with a child. They can be very empathetic, as I'm sure if you guys with animals know. Hospice. This is actually a picture of a hospice wing in a hospital, and that's a llama. It's pretty amazing, isn't it?
Yeah.
In the prison system, not only do they use dogs as in therapy in the prison, but prisoners also do training. They do the obedience training, and they work with the animals. And I've heard that that in itself is therapeutic for the prisoners, and then it makes, often causes them to relieve their aggression, get rid of some anger, and sometimes turn around. So they've claimed, or the prisoners say that it's something that has changed their lives. So what are some of the benefits? These are documented physiological responses from scientific research that's been done on animal-assisted therapy. It's been known to lower blood pressure, lower heart rate, reduce stress, reduce depression, anxiety, and heart disease risks, which is always nice. Other benefits are you can reduce your loneliness and isolation, nurturing behaviors. It enhances cognitive development in children and increases communication and prosocial behavior and raises self-esteem. It's just many, many benefits that aren't even on this list. Here we are at self-esteem. Researchers found that in patients with schizophrenia that it raised their self-esteem and had a positive impact on their psychiatric symptoms. Which is amazing to me because we often think of these diseases and these disorders as something that's going to take lots of medication to cure. And they found that in conjunction with therapy and with animal-assisted therapy, you can reduce the amount of medication and they can still make progress. Children with ADHD and conduct disorders it's been shown that animal-assisted has helped them with their aggressive behaviors. Increases mood, reduces depression in psychiatric patients as with many therapists have stated that their unresponsive and withdrawn children have really responded better when an animal is present. Another population that's really helped by animals is children with autism, or even adults, people with autism. Animals have really given them someone to be able to trust in and to bond with when they have difficulty doing so with other people. So here are just a few case studies that I thought were really interesting just to kind of affirm what a great resource animal-assisted therapy can be. This was an instance where this woman the girl was unassertive and she had low self-esteem and withdrawn. And animal-assisted therapy was brought to her, and she was able to walk the dog and pretend like the dog was hers. And when people would ask questions, she would say, "Oh yeah, this is my dog," and it increased her communication skills and increased her self-esteem, and it really helped her to make progress. So that's one way that it's been used. Okay. This was another instance when a 23-year-old licensed practical nurse was brought in with psychiatric symptoms, with some symptoms of psychosis. And she then went into a catatonic schizophrenia, which was with the excited type. So she was just as you can imagine, in a bad way. She wasn't doing well, right? So therapists decided to bring in pet therapy. And through working with the dog, petting the dog, she was able to make progress without a lot of drugs in a very short amount of time. And everyone was surprised and amazed at the impact that it made. This was, yeah, it's amazing. And here's another one where a 9-year-old boy was in a session. He was intrigued by Kayla, which is a therapy dog. And so he was very excited about her, and he was petting her, and he didn't understand why she wouldn't do tricks, I think is what it is. she wouldn't perform, and like she was tired, and he wanted her to keep working, but she was tired. And so the therapist said, well, I'm sorry, but she's really tired and she needs some rest. And Jeremy blurted out and said, well, then why don't you hit her? Right? So what does that tell you?
He's been hit.
Exactly, right. And so you can learn so much with it, even with just a session with a child that's not, that doesn't have a serious diagnosis. It's a way for children to be able to communicate with you, and you'll learn so many things. So then they went on and discussed it, and he was able to open up and talk about what it was going on with him at home. And it's pretty amazing. Another instance of where it worked amazingly well like that was with my friend Mari, who was working with Pearl's dad, Boudin. And she had a child that just wouldn't talk, just wouldn't open up, wouldn't talk, was so afraid, had been abused, but wouldn't discuss it, wouldn't even open her mouth. And so she brought Boudin in. Boudin just sat with her. And so for one session, he just sat with her, and she petted him and she played with him. And the next time she came back, she just sat with her again. And about midway through, she started talking to Boudin. And then she started talking to Boudin, saying, does your family love you? What is your... And she started telling her whole story to Boudin, as if Boudin was another person that she could share, because she had developed a bond and a trust with them. So it's really wonderful what these animals can do. Here's another case study this is where a rabbit came in, and it really just was a way for her to kind of relax and pet the rabbit and talk. Well, I'll let you read it.
You can't read it.
Okay. I can barely read it. This is an instance where the child, kind of like the story I just told you, that she started talking, she was petting a rabbit, and she started talking about the rabbit and how she wanted to know if maybe the mother, she said, well, the mother must have chewed the rabbit's ears all up. But of course the rabbit's ears weren't chewed, they were normal. And so that opened up again for the therapist to be able to talk to her about, well, tell me, why would a mother, why would that happen? Why would the mother chew up the ears? And then that brought the child out to be able to talk about what was going on in her life. So children are essentially able to relate to the animals. So this is one more this is actually a center in Hawaii that does animal-assisted therapy. And this is kind of their promo video, but I thought it was very interesting and that you would enjoy it.
Something that I'm really excited about is we're incorporating 2 new types of therapy. The first therapy is equine therapy, whereby one of our clinical psychiatrists takes the group of us and we go out to a ranch and we interact with horses.
Animals don't judge and they don't have an agenda ahead of time. And so for individuals that have erected defenses, particularly if they're intellectual types of defenses, they can give you reasons for all their behaviors. And they confront a situation that they're not familiar with, and they have to deal with it in a way that gets around their usual types of defenses. And so these animal-assisted psychotherapies are experiential, and they bring up a variety of emotions that the person might otherwise attempt to control or deny.
Both dolphins and horses are large, powerful animals, and both evoke a very strong emotional reaction from all of us. I think people in recovery can oftentimes be more vulnerable. Their emotions can be closer to the surface, and through the use of horses as well as dolphins, it can really help to elucidate people's fears, some of the blocks they may have in the recovery process. Ultimately, what we hope it helps to reveal our strategies and strengths that will aid someone's long-term sobriety.
Picture this. You come to Hawaii, and you're here for a week, and on that Saturday, we say, okay, everybody up, we're going to the harbor. We get on a boat, we take the boat out with another clinical psychiatrist, and we are going to interact and swim with the dolphins in their natural environment.
The dolphins are extremely sensitive, they're able to feel a lot of human emotions, and their choice about interacting with you when you're in the ocean will be based also upon the type of messages you're giving them. So it's a highly interactive and highly emotional and moving therapy for many people.
Can you imagine getting on a boat, going out in the Pacific Ocean, and swimming with dolphins in their natural environment, interacting with them, just enjoying that creation, enjoying that energy? And that's something that you can keep with you for a lifetime. While we're doing that, we also take photos of you interacting with the dolphins, video, and things of that sort that you can take with you upon leaving here and share with your family. These are things that are priceless. It's a new concept that we're doing, and I look forward to sharing that with all of you folks.
So I'm about to sign up.
Right. Vacation.
So thank you for your time. Does anyone have any questions that I can answer for you? Or not answer? I can try.
Can we ask Pearl a question?
You can. She'll probably answer if you give her a treat. That's okay.
I have a question, Katy.
Yes.
Do you think this animal-assisted therapy is going to become more popular over medications in hospitals, psychiatric wards, whatever? I help our pastor play it when he does the services out at Crestview. And when you talk about animals, they have birds there, and I thought that was the most bizarre thing ever. They'll be singing these birds, blah, 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 blah. You know, I'm like, you know, what's going on here? And you also see fish. And I thought, you know, gosh, over medications, if you can do something as simple as that. I just wondered what your thoughts on that was.
I don't think it'll ever take the place of medication. I think certainly medication has its place and its uses. And however, I think often, my personal opinion, people can be over-medicated often, particularly children who are, there's a great overdiagnosis of ADHD and ADD in the schools. And so then these children are given medication unnecessarily. And if the children could just have a little time in therapy with some animals, then perhaps that medication could be, it would be unnecessary. They wouldn't have to give them. So that's just one example. So in answer to your question, I don't think it's not going to take the place of, but I do think that it's becoming more popular. The research is becoming more. There's more thorough, there's more research out there, more scientific outcomes are showing that the benefits of being with an animal in any sense, well, except when they're hurting you, that's not good, but when you're with an animal and it's a pleasant experience, then there's so many benefits to it. People are really starting to wake up to that and to start incorporating them in all sorts of, I don't know about you guys, but sometimes, you'll just walk into a business and they have their animals there. It's really nice to see that happening and see the animals having a bigger place in our lives.
I've seen a number of Averys in nursing homes.
Yeah, where my mom was Pioneer Manor, yeah, in Springs, back in Wisconsin too, at Avalon Manor.
Yeah.
So.
And the nursing homes that I worked for an agency, and we went to several different homes, and one of the homes allowed the patients to bring, or the residents to bring their animals with them. So they actually had, dogs, mostly dogs. I think there was maybe one cat living there with them in the residence home. So I've always said that's all I'm doing. If they can't take my dog, they're not taking me either. We'll both be living on the street, I'm sure.
There was a woman there at Pioneer Manor, And she had her little dog, and then she always had her beer.
And a cigarette. And she'd go outside
And she'd go outside. It was really quite, it was enjoyable to talk with her and just watch her in action
She
with the
loved-
little dog.
They had that little wren.
Yeah,
Up to the window.
Yeah, so outside of her room. I wanted to ask you how much Pearl has to learn yet. She's so well behaved.
Oh, thank you.
Yeah, I mean, really.
She's on her best behavior, and I'm so glad. I promised her a few things.
But what do you have to teach her yet? Because you said she has that next level.
She's
Yeah.
been through the Canine Good Citizen obedience training, which is it's the highest one you can go in your ordinary. See now what? Oh, she's gonna come see everybody.
Meet and greet.
That's right, exactly. Barbara, say hi. No.
See, she hasn't quite learned
That's
to
what she
leave
has
food
to learn.
alone.
She's demonstrating for you what she has to learn.
You mean to just sit and not to interact?
Well,
The food.
the food.
Oh, okay.
Our dog would never make it.
No.
Abigail.
How old is she?
She just turned 6 in December.
What does she do when you're working?
Well, I'm not currently practicing counseling right now because I'm teaching here at the college. And so, but I do take her to my office on occasion. Don't tell anybody. Pearl, come here. What's that? And she, so often I'll bring her to the office with me, and she'll just sit in the office. And sometimes when the kids will come in, I'll always ask if they don't, oh, there's a dog, is everything all right? And they're always usually a string of people coming by my office to say hi and to visit with her. So, oh, what's the matter?
But then basically all she has to learn is not to be distracted or to eat when
Right.
she's not supposed to, or.
There's a list of things of different skills that they have to learn and pass in order to pass the exam. And many of those are the commands, as the obedience commands, which is sitting, being calm, allowing people to touch you and to pet you. With Pearl, she has yet to learn to walk by, they have to walk by food and not touch it.
I can't do that.
I know.
Other people.
Go for it, lick Inside joke. I have a question for you. What's the line between an animal-assisted therapy and then let's say, a working dog, like a CNI dog or a police dog?
Service dog.
Service dog, yes, service, thank you.
Two different things. They're all animals that are in service for people. However, service dogs are, what's the word I'm looking for? They're accepted through the government as a service dog, so they get certain benefits, meaning you can take them on airplanes, you can do all sorts of things with service dogs that you can't with animal-assisted therapy, because it hasn't been, I don't know the exact terminology, but it hasn't, the government has accepted it as animal-assisted therapy as a service dog. It's a separate field. And so, unfortunately, there aren't as many benefits for animal-assisted therapy dogs. Service dogs are really more for physical ailments. Service dogs, for instance, CNI dogs, they're also dogs who are trained to recognize seizures. So they'll be with a person who is prone to seizures, and they can see them, feel them coming on, and they will. I read recently a story about this dog and its owner, and the owner had a seizure, and it was a serious one, and couldn't get to the phone. The dog actually went to the phone. I think the phone was ringing, actually. The dog went to the phone and knocked it over and barked into the receiver. And then whoever was calling knew that there was a problem. It was amazing. So they're trained to do all sorts of things. There are service dogs that are trained to help people who are disabled, and aren't able to get around. Say, for instance, they're in a wheelchair, and so the dogs are trained to go and pick things up for them, or to mainly just to pick things up for them, I think. Also I've seen them in action, and I can't off the top of my head come up with the kinds of things that they do, but they're very, very helpful in helping this person to be able to function better in life. So that's the difference.
I've seen the thing on the prisons where just letting them have cats makes a huge difference. But certain prisons, you have to earn the privilege to have a cat. It's just night and day for them. So. Because you have something that you're responsible for, that you have to care for, and that is not going to judge
Imagining
you.
Bubba over there with his cat.
Maybe Bubba should have a rabbit.
Yeah.
I have a pup that recognizes low blood sugar.
That's amazing.
And he's had no training at all. In fact, he isn't really too obedient, but when he starts barking and comes and gets me, I know we have problems.
I've read that smelling, that certain dogs can smell cancer.
Oh, I've read that.
I've seen it on TV, yeah,
amazing.
exactly, yeah.
This article was given to me by a colleague. It's the New York Times Magazine, looking for the front page here. There it is. New York Times Magazine, February issue. And there's an article in here called Wonder Dog, and you can find it online. I looked it up today. It is the most amazing story about a dog who is a service dog for a child who has autism, I believe. And the child, at first, the dog wasn't trained to do this, but as the dog became bonded with the child, it soon was able to recognize when the child was going to have temper tantrums, because apparently this was a big issue, and so the dog would recognize and go and get himself underneath or lay on top of him. That's right. He would go and lay on top of the child, and it would be soothing and calming, and the child would not have the temper tantrum, or it would be much more mild. And the dog wasn't even trained to do that, just learned through working with the child and noticing that this was helpful, and so the dog would do it. They're very empathetic, and which is something we can't really measure, I don't think. And you don't know that they all are. Carl's not really all that empathetic. She don't really care.
I did some research on dogs working with Alzheimer's or dementia patients, and it's just I've only been able to find it in Europe, but they actually are able to make the dementia patient happier, but they're also trained to stick with them like a bird. And they have GPS tracking with them so that if the person wanders off, the dog wanders off with them, and they can be located.
Wow.
But I haven't found that in the United States at all.
Yeah. That's amazing. I believe that there are more, from what I understand, there are more regulations in the States than there are in other countries. The other countries are working with dogs more, or allowing dogs to do more things. Here we're so regulated, unfortunately. In fact, this story was partly about the woman who started this agency or this organization in order specifically to place dogs with children, because other agencies would not do so because of liability, because they didn't think that children were able to control the animal. And so she, as a child, really needed one, and she eventually was able to get one through the back alley. And so as she got better, she started her own organization. Now it's a huge organization. She is still, I believe, disabled, but yet she has this large organization that she runs, and they specifically look for children in need who would. It's an amazing story if you can have time to read it. So that's here in the States. Like I said, they have so many regulations that unfortunately cause some people to suffer more than I think they should have to. Yes.
I wonder sometimes, I have some protective feelings toward the animals being used in therapies. I mean, are there some protections that are put into place to protect animals?
That is why you have to have the licenses and you have to go through the training, is so that you can properly take care of the dog as well. The story earlier about when the woman was telling the child, he's really tired and needs to rest. And that's something that all the therapists that I know that work with animals are very conscientious of what the dog is doing. For instance, her dad, Boudin, has a specific amount of working time, and then he's off the clock, is what she says. She takes off his little tag and the special leash that he wears, that he knows when those things are on him, he's working. So at a certain point, she takes it all off and she puts him away and she lets him play. And she's very conscientious of making certain that he doesn't get overwhelmed or tired. And of course, she takes care of him physically and keeps him safe in those ways. So, you can't control it, I suppose. There are going to be people who might abuse the animals by not really paying attention and respecting their needs. But you hope that that's not the case, and you're trained as you go through the animal training, the training to work with animals, to really be conscientious of their needs. Yes?
How long did it take you, like how large or number of credit hours or length of time to learn the training for your animal, for Pearl? That's a better way to call it.
Well, with Pearl, you have to go through all the training, so that takes a while. The difference of obedience training, and then so I haven't even gotten there yet. So I'm still working on it. For the therapist,
Yeah, that's what.
So there's the licensing and the working with the animal, and then for the therapist, if you're just going to do animal activities and you're not a licensed therapist, then there's a training that you go through, and there's actually a class that you can go to and take your animal and you work with the animal and learn how to work with the animal in the presence of a client or in the presence of other people in nursing homes, whatever. But if you're a therapist, there's a class that I'm actually in the process of taking through correspondence from. They're offered in many places. This particular one is from North Texas in Texas. Go figure. And it's a whole class, where you learn all about animal-assisted therapy, and then once you're done with that, the end of the last portion of the class is working together with your animal. So the therapist can become certified by taking this class, and then the dog becomes licensed, and then you work as a team.
I see.
Yeah.
Thank you.
Well, thank you, Katy. That was very